All right, let's talk about something most of us, especially for younger, probably don't think about much: colorectal cancer. You might hear that and think, that's an old person's disease, right? Well, that's the thing. The story is changing and fast. I'm just going to throw a number at you right out of the gate: 7 times. Now, that's not just some random statistic. It represents a massive and honestly a pretty alarming shift in who's at risk. So, what does it actually mean? It's not just about the numbers. It's a real fundamental change. The Nevada Cancer Coalition put it perfectly. Younger generations are facing a very different reality. This just isn't your parents' or your grandparents' disease anymore.
And that brings us right here. We're going to dig into how colorectal cancer has quietly become this huge generational threat, basically turning everything we thought we knew on its head.
Okay, this is probably the single most important fact to wrap your head around. I mean, really let this sink in. For people under the age of 50, colorectal cancer is now the leading cause of cancer death. That old belief that this is an old person's disease, it's not just outdated, it's dangerous. So, how in the world did we get here? Well, researchers have this term for it called the birth cohort effect, and this timeline shows it so clearly. If you were born around 1990, your risk of getting colorectal cancer before you turn 50 is 5 to 7 times higher than someone who was born back in 1960. It just goes to show that something has fundamentally changed for younger generations. And the contrast is just stark when you look at the trends. For decades now, rates in adults over 50 have actually been going down, which is great. That's mostly thanks to effective screening. But for adults under 50, it is a completely different story. We're seeing this sharp, steady, relentless climb. The cases are skyrocketing. Which leads to the million-dollar question, right? Why? Why is this happening now? And what in the world is driving this terrifying trend in younger people? And this is where the story gets really, really interesting. Yeah, genetics play a role, of course. But look at this. A staggering 55% of all colorectal cancer cases are linked to what they call modifiable lifestyle factors. That means that more than half the time, the risk is tied to choices we can actually influence. So what are we talking about here? Well, it's a lot of the things we hear about all the time, right? Diets that are high in red and processed meats, not getting enough physical activity, obesity, long-term smoking, and drinking too much alcohol. Scientists believe these are some of the main culprits behind the crazy increase we're seeing. But hey, it's not all about lifestyle. It's super important to know the difference between specific hereditary conditions like Lynch syndrome. Those account for maybe 5–10% of cases, and a more general familial risk. Up to a third of all cases have some kind of family link, even if there isn't a specific name syndrome. The bottom line is, if a close relative had it, your own risk goes up significantly. Okay, so we know the risks are going up. That brings us to a super critical topic: symptoms. And this is an area where younger people are at a huge disadvantage because the warning signs are so often missed or just brushed off by patients and sometimes even by their doctors. These are the classic red flags you want to watch for. Persistent changes in your bowel habits, any rectal bleeding, abdominal pain that won't go away, unexplained weight loss, and that deep fatigue or weakness that comes from anemia. But, and this is a big but, the crucial thing to get is that by the time you actually see these symptoms, the cancer might have already advanced. So, what's the most common symptom of early-stage colorectal cancer? You ready for this? There isn't one. Nothing. Zip. Nada. In its earliest, most treatable stages, this disease is completely silent. And that right there is why just waiting for symptoms to show up is such a risky game. I know this all sounds really concerning, but the story doesn't end there. We're about to shift from the problem to the solution, because your single most powerful weapon in this fight is screening. And here it is, the new number that everyone needs to burn into their brain: 45. Yup. In direct response to this crisis of early-onset cases, all the major health organizations have officially lowered the recommended screening age for average-risk folks from 50 all the way down to 45. That is a massive, game-changing policy shift. And remember, 45 is the starting line for average-risk people. If you have a close relative, like a parent or sibling, with colorectal cancer, or if you have a history of inflammatory bowel disease like Crohn's or ulcerative colitis, you are considered higher risk. You absolutely need to talk to your doctor about starting screening even earlier than that.
So you know you need to get screened, but what does that even mean? What does it look like? Let's quickly break down the most common options so you can go to your doctor and have a really informed conversation.
You've actually got several choices. There's the colonoscopy, which is usually done every 10 years. It's kind of the gold standard because it can find and remove precancerous growths called polyps all in one go. Then you have less invasive tests you can do right at home. The FIT test checks for blood in your stool every year, while Cologuard, done every 3 years, looks for both blood and cancer-related DNA. They all have their pros and cons, and the best one for you is something you and your doctor should decide together.
Look, at the end of the day, this whole conversation is about one thing: awareness. The rules have changed. The risk for younger adults is real, and it's growing. It's not something you can just put off thinking about anymore. So the only question that really matters now is, you know the risk. What's your next move going to be?